Now we're going to hear from Adejoke Oguns at the Barcelona of Anaemia Services, which is out at Queen's Romford. They've been a real success story within London and I think nationally, and we have been fortunate to hear from this team before at the RTC business event, I think maybe back in about 2017. But we're now going to hear about what was involved in maintaining this service, which is critical to patient blood management during the preceding months. So remember to everyone, microphones off, and we're over to Adi.
Thank you so much. Good afternoon, everyone. My name is Adejoke. I'm an anemia nurse at Queen's Hospital. Okay, first slide, please. Thank you. The Nation of Anemia Clinic Service is just for everyone to be aware. We are multi-speciality. We take referrals from nearly everywhere from A&E. We support patients that are already in the hospital, that have been discharged, and then having to come back for an outpatient appointment with the anemia service. We deal with the obstetric patients as well. And also we have a cohort of patients that we follow up. People with severe menorrhagia. We have people with inflammatory bowel disease, and also the chronic GI blood loss patient. And among the chronic GI blood loss patients, most of them are elderly people. So we actually have quite a lot of elderly population with that. And also we get referrals from the pre-assessment people for patients awaiting procedure in order to correct their anemia and to optimize their hemoglobin level before their procedure. Next slide, please. And when the COVID situation actually come into place, we had to come up quickly with a business plan for continuity of the anemia service. So the aim of that is to actually identify how can we keep this service going safely and to prevent any admission to the hospital as well. So many of the thing is to reduce patients coming to the hospital for iron for anything apart from let's say their HB just drop like that. So we just try as much as possible to prevent admission being happen, and also to aid rapid discharge. People that are already in the hospital, what we can do to make sure that they are discharged on time, and also to prevent unnecessary blood transfusion. So we don't want the patient that are iron deficient to end up getting blood transfusion. So the next agenda was for us to be able to support rapid treatment of people that are already presented in an A&E. So instead of them sending them away and sending them back to the hospital another time, we try and treat them here and there. So they don't need to go without having the treatment. And then we also wanted to maintain our obstetric service as well. So we don't want to lose those set of patients. And also there is another thing, we have referrals from the GP, and because of the natures of the COVID, patients are unable to attend their GP surgery for so many other tests. So we tend to take over more work from the GP side. And the 2-week wait referral patients, which cannot be delayed. So those are the reasons why we think there is no way the anemia clinic can stop. So the action that we actually put in place is, firstly, we liaise with a pharmacy in the Queen's Hospital in order to increase our Monofar stock, and also to be able to get their consent in order to be able to use the Monofar in other areas of the hospital, apart from the anemia clinic. The other thing that we do is to make a different stream for the obstetric patients so that we can separate them and see them in their own environment. So we liaise with the obstetric team and get a place on the antenatal ward, and then we administer Monofar to those patients over there. And in doing that, we're able to actually aid staff education as well. So the midwife were able to learn how the Monofar can be administered safely, and when the patients had any reaction, how they can re-challenge that without just abandoning the treatments. Also, we had to increase so many the follow-up from the GP referrals. We have, which we don't normally follow up. We have cohorts of most of them that we increase from the GP referrals as well. So instead of them going back to their GP for blood tests or any other screening, we tend to do that ourselves. So the measure that we actually put in place for patients to come into the clinic to make sure that it's safe for them to come to the hospital, we draw up some questionnaires and checklists. And in that questionnaire, it's just for us to ascertain whether they have any symptoms of COVID or if anyone in the household has had any symptoms of COVID as well. And also their comorbidities in order to be able to make sure that we allocate the right time for them to come into the clinic. In that case, we consider people that their immunity has already been compromised so that we don't mix them with other patients group. And the other thing is that we actually change our clinic setup. In that case, we reduce the capacity that we normally see. On a normal period, we see 16 patients on a Friday. So, but with the COVID situation, we had to space them out in order to maintain social distances as well. Due to the COVID situation as well, we became very strict on not allowing any visitors to come in with the patients. So we don't allow their relatives to come in. They can drop them off. They have to go off the premises and then come back when they finish to pick them up. And the other thing is that we make sure that we have a strict decontamination and cleaning after each patient before we admit any other patients to that area. And with the other thing is we try as much as possible to minimize patients in our waiting area. So in how we achieve that is just that spacing out their appointment time so that we give one a different set of people a longer period of time so that they don't double up on their appointments. Okay, so the challenges that we actually face is we normally have a telephone clinic that we run, but due to the COVID situation, that number actually jumped up quite a lot. So we had a course of so much patients that we had to follow up, checking up on them to make sure that their blood level are still okay, that they're having regular blood tests and things like that. The other thing, arranging blood tests, because it's difficult for patients to get appointments in the community for the blood tests of even going to the hospital as well. We tend to take up the blood tests ourselves. So they tend to start coming to us for blood tests. And at the same time, the other thing we did is we actually compile the list of places in the community where they can get the blood tests done. And then we give them those lists so that they can book an appointment for that, just to reduce a bit of our workload. And the other challenges that we actually face is that some patients, because of COVID, they find it very reluctant to come to appointments. So in that case, we tend to advise them to try as much as possible to use oral iron supplements. Even there's some patients that say that they are intolerant of iron, oral iron, but due to COVID, they were able to tolerate at least something, even liquid iron at that particular time, so that it can tie them over and prevent them from getting blood transfusion. And quite a lot of people as well had anxiety when you ask them to come in for appointments. They are very scared because of COVID that they don't want to come and contact COVID or anything like that. So what we actually do, we try as much as possible to reduce the anxiety and make sure that we give them information that the clinic is safe for them to come in, so that there is nothing to worry about, that there is a use of PPE, and that we make sure that they use a mask as well to protect themselves. So we actually make them feel more comfortable in coming to the hospital. So next slide, please. Okay, so from the impact of the patient that we actually treated during the COVID period, we have a reduced number of patients that compared to what we would have normally seen. During that period, we were able to see 174 patients, and out of them were 44 obstetric, 44 from our follow-up of cohort patients, and 86 new patients. And because I was unable to actually see how many patients we were able to prevent from admission or prevent blood transfusion to, so we just decided to do a map of look at the level of hemoglobin and to see how many we actually came into the clinic with very low hemoglobin. So the ratio of the patient that we've seen, I think I've jumped. We saw 48% of patients compared to during the COVID period compared to the patient that we would normally have seen. And out of that, 2.3% of the patients age 16 and below has an hemoglobin of 70 or less. And also 14.7% of patients age 16 and above had an hemoglobin of 80 or less. So we believe that if we haven't actually catch those patients and transfuse iron infusion, they would have ended up having blood transfusion or being admitted to the hospital for one thing or the other. Yes. And thank you.